Hey future nurses. Today, we're tackling 20 uncommon, complex medication questions that could trip you up on test day. And don't forget, all these practice questions and more are available in the Clinique RN bank with AI-powered feedback, detailed rationales, and a readiness predictor to track your progress. Stick around. This could be the edge you need to pass the NCLEX. Question 1. A client receiving a continuous infusion of norepinephrine suddenly develops pallor and a cool, painful sensation at the IV insertion site. The nurse suspects extravasation and should prepare to administer which antidote? 1. Naloxone. 2. Phentolamine. 3. Flumazenil. 4. Protamine sulfate. Correct answer. 2. Phentolamine. Rationale. Phentolamine is a powerful alpha-adrenergic blocker. When a vasopressor like norepinephrine extravasates, leaks into the surrounding tissue, it causes severe vasoconstriction, leading to tissue ischemia and necrosis. Phentolamine is administered directly into the affected tissue to induce vasodilation, thereby restoring blood flow and preventing tissue death. Incorrect option 1. Naloxone is an opioid antagonist used to reverse the effects of an opioid overdose. Incorrect option 3. Flumazenil is a benzodiazepine antagonist used to reverse sedation from medications like midazolam or diazepam. Incorrect option 4. Protamine sulfate is the antidote for a heparin overdose. Clinique RN Test-Day tip. When a question describes a medication extravasating, think about what the medication does. Vasopressors cause vasoconstriction, so the antidote must cause vasodilation. Remember this simple principle to narrow down your choices. Question 2. A client with diabetes insipidus is receiving Desmopressin, DAP, which finding indicates the medication is having the desired therapeutic effect. 1. Decreased urine output and increased urine-specific gravity. 2. Decreased blood pressure and increased heart rate. 3. Increased urine output and decreased urine-specific gravity. 4. Increased blood glucose and decreased sodium levels. Correct answer. 1. Decreased urine output and increased urine-specific gravity. Rationale. Desmopressin, DAP, is a synthetic form of antidiuretic hormone, ADH. In diabetes insipidus, the body does not produce enough ADH, leading to excessive water loss. The desired effect of desmopressin is to act on the kidneys to conserve water, which results in decreased urine output and a more concentrated urine, thus increasing urine-specific gravity. Incorrect option 2. These are signs of fluid volume deficit, not a therapeutic effect of desmopressin, which is meant to increase fluid volume. 3. This describes the symptoms of diabetes insipidus, indicating the medication is not working or is not being given. 4. Desmopressin does not directly affect blood glucose or sodium levels in this manner. The primary effect is on fluid balance. Clinique RN Test-Day tip. For medication questions, always ask yourself, what is the medication's intended action? For DAP, it's an antidiuretic. The prefix anti- means against, so it works against diuresis, excessive urination. Question 3. A client is brought to the emergency department after an opioid overdose. The client is unresponsive with a respiratory rate of 6 breaths per minute. The nurse should prepare to administer naloxone. Which action is the highest priority after administration? 1. Assess the client's pupils. 2. Prepare to administer a second dose. 3. Secure the client's belongings. 4. Monitor the client for a return of pain. Correct answer. 2. Prepare to administer a second dose. Rationale. Naloxone has a much shorter half-life than most opioids. The nurse should be prepared to administer a second dose because the client can revert to respiratory depression once the naloxone wears off. The priority is to maintain a therapeutic effect and prevent the client from becoming unresponsive again. Incorrect option 1. Assessing pupils is part of the initial assessment but is not the highest priority after administration. The priority is to ensure the client continues to breathe. 3. Securing belongings is part of routine emergency care, but is not a life-saving priority. 4. The client may experience a sudden return of pain. This is a secondary concern to maintaining a patent airway and adequate respirations. Clinique RN Test-Day tip. Remember the half-life. Many NCLEX questions will test your knowledge of drug half-lives. A drug with a shorter half-life than the substance it's counteracting, like naloxone and opioids, requires you to anticipate repeat dosing. Question 4. A nurse is caring for a client with a continuous infusion of Propofol for sedation while on mechanical ventilation. The nurse should monitor the client for which of the following adverse effects? 1. Malignant hyperthermia. 2. Hypotension. 3. Severe bradycardia. 4. Peripheral edema. Correct answer. 2. Hypotension. Rationale. Propofol is a sedative hypnotic agent with a short half-life used for procedural sedation or for maintaining sedation in intubated clients. A common and significant adverse effect is hypotension due to its vasodilatory properties. The nurse must continuously monitor the client's blood pressure during the infusion. Incorrect option 1. Malignant hyperthermia is a rare side effect associated with certain inhaled anesthetics and succinylcholine, not propofol. 3. Propofol can cause bradycardia, but hypotension is a more common and often more significant adverse effect to monitor for in a continuous infusion. Incorrect option 4. Peripheral edema is not a direct side effect of propofol. Clinique RN Test-Day tip. In a critical care setting, always monitor for the most immediate and life-threatening adverse effects. For a sedative, the most likely adverse effects are on the ABCs, specifically breathing, respiratory depression, and circulation, hypotension. Question 5. A nurse is teaching a client about administering Isoniazid, INH, for active tuberculosis. Which of the following is an essential teaching point for the nurse to include? 1. Take this medication with meals to avoid stomach upset. 2. You should avoid foods and drinks containing tyramine. 3. You may notice your urine turning a reddish-orange color. 4. Report any signs of numbness or tingling in your hands and feet. Correct answer. 4. Report any signs of numbness or tingling in your hands and feet. Rationale. Isoniazid, INH, is a common first-line medication for tuberculosis. A significant and potentially severe side effect is peripheral neuropathy, which presents as numbness or tingling in the hands and feet. This is caused by a vitamin B6, pyridoxine, deficiency induced by the medication. The nurse should teach the client to report these symptoms immediately and should anticipate a prescription for vitamin B6 supplementation. Incorrect option 1. INH is best absorbed on an empty stomach and should be taken at least 1 hour before or 2 hours after meals. Incorrect option 2. Tyramine-containing foods should be avoided when taking certain MAO inhibitors, like phenelzine, not INH. 3. A reddish-orange discoloration of urine is a classic side effect of another TB medication, rifampin, not INH. Clinique RN Test-Day tip. NCLEX loves to test you on the specific side effects of TB drugs. Remember, the mnemonic INH can cause neuropathy and hepatotoxicity. Question 5. A nurse is teaching a client about administering Isoniazid, INH, for active tuberculosis. Which of the following is an essential teaching point for the nurse to include? 1. Take this medication with meals to avoid stomach upset. 2. You should avoid foods and drinks containing tyramine. 3. You may notice your urine turning a reddish-orange color. 4. Report any signs of numbness or tingling in your hands and feet. Correct answer. 4. Report any signs of numbness or tingling in your hands and feet. Rationale. Isoniazid, INH, is a common first-line medication for tuberculosis. A significant and potentially severe side effect is peripheral neuropathy, which presents as numbness or tingling in the hands and feet. This is caused by a vitamin B6, pyridoxine, deficiency induced by the medication. The nurse should teach the client to report these symptoms immediately and should anticipate a prescription for vitamin B6 supplementation. Incorrect option 1. INH is best absorbed on an empty stomach and should be taken at least 1 hour before or 2 hours after meals. Incorrect option 2. Tyramine-containing foods should be avoided when taking certain MAO inhibitors, like phenolzine, not INH. 3. A reddish-orange discoloration of urine is a classic side effect of another TB medication, rifampin, not INH. Clinique RN Test-Day tip. NCLEX loves to test you on the specific side effects of TB drugs. Remember, the mnemonic INH can cause neuropathy and hepatotoxicity. Question 6. A client is admitted with an acute thrombotic stroke and is a candidate for a fibrinolytic agent. The nurse should anticipate administering which medication? 1. Heparin. 2. Warfarin. 3. Alteplase, TPA. 4. Clopidogrel. Correct answer, 3. Alteplase, TPA. Rationale. Alteplase, TPA, is a tissue plasminogen activator, a fibrinolytic agent used to break down clots. It is the drug of choice for an acute ischemic, thrombotic, stroke, provided it can be administered within the therapeutic window, typically 3 to 4.5 hours from symptom onset. Incorrect option 1. Heparin is an anticoagulant that prevents the formation of new clots but does not break down existing ones. Incorrect option 2. Warfarin is a long-term oral anticoagulant and is not used in the acute management of a stroke. Incorrect option 4. Clopidogrel is an antiplatelet medication used to prevent clot formation but is not used to dissolve an existing clot. Clinique RN Test-Day tip. Remember the difference between antiplatelets, anticoagulants, and fibrinolytics. Fibrinolytics, like TPA, are clot busters for active emergencies, whereas antiplatelets and anticoagulants are for preventing new clots. Question 7. A nurse is administering a dose of lithium to a client with bipolar disorder. Which lab value should the nurse monitor most closely due to the medication's narrow therapeutic range? 1. Serum sodium, not plus. 2. Blood urea nitrogen, BUN. 3. White blood cell, WBC count. 4. Serum potassium, K+. Correct answer. 1. Serum sodium, not plus. Rationale. Lithium's therapeutic range is very narrow, 0.6 to 1.2 milliequivalent/L. The kidney handles lithium and sodium similarly. Hyponatremia, low sodium, can lead to lithium toxicity because the kidneys will reabsorb more lithium in an attempt to retain sodium, causing lithium levels to rise. Incorrect option 2. BUN is a measure of renal function, which is important, but sodium levels are the direct influence on lithium's reabsorption and toxicity. Incorrect option 3. A high WBC count could indicate an infection, but it is not directly related to lithium's therapeutic range or toxicity. 4. While potassium is a key electrolyte, its levels do not have the same direct effect on lithium reabsorption as sodium does. Clinique RN Test-Day tip. For a client on lithium, think lithium-sodium interaction. A low sodium intake or a hot day with a lot of sweating can increase the risk of lithium toxicity. Question 8. The nurse is caring for a client with trigeminal neuralgia who is prescribed carbamazepine. The nurse should instruct the client to immediately report which of the following signs? 1. Nausea and mild dizziness. 2. A sore throat, fever, and bruising. 3. Increased urine output and thirst. 4. Persistent constipation. Correct answer. 2. A sore throat, fever, and bruising. Rationale. Carbamazepine is an anticonvulsant used to treat trigeminal neuralgia and bipolar disorder. A rare but serious adverse effect is bone marrow suppression, which can lead to a dangerously low white blood cell count, agranulocytosis, anemia, and thrombocytopenia. A sore throat, fever, and bruising are signs of infection and bleeding, which indicate potential bone marrow suppression and require immediate medical evaluation. Incorrect option 1. Nausea and mild dizziness are common side effects of carbamazepine, especially when first starting the medication. They are not considered a life-threatening emergency. 3. Increased urine output and thirst can be signs of diabetes insipidus, which can be a side effect, but bone marrow suppression is a more severe and life-threatening concern. 4. Constipation is a common side effect of many medications, but is not a sign of a critical adverse reaction. Clinique RN Test-Day tip. When an anticonvulsant medication is listed as an option, always consider the possibility of bone marrow suppression as a serious side effect. Look for signs of infection, fever, or bleeding, bruising.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you missed questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
Question 9. A nurse is preparing to administer bumetanide to a client with severe heart failure. The nurse should be aware that this medication is classified as a 1. Potassium-sparing diuretic, 2. Thiazide diuretic, 3. Loop diuretic, 4. Osmotic diuretic. Correct answer, 3. Loop diuretic. Rationale. Bumetanide is a powerful loop diuretic that acts on the loop of Henle in the kidney to inhibit the reabsorption of sodium and chloride. It is often used to treat severe fluid overload, such as that seen in heart failure, because it is more potent than other diuretics. Incorrect option 1. A potassium-sparing diuretic, e.g., spironolactone, is a much weaker diuretic and is used to counteract potassium loss, not for rapid fluid removal. Incorrect option 2. Thiazide diuretics, e.g., hydrochlorothiazide, are less potent than loop diuretics and are typically used for long-term management of hypertension. Incorrect option 4. An osmotic diuretic, e.g., Mannitol, is used to draw fluid from the brain to reduce cerebral edema. Clinique RN Test-Day tip. Remember the location, power, and common side effects for each type of diuretic. Loop diuretics are the most potent and work on the loop of Henle, causing significant fluid loss and electrolyte imbalances, especially hypoglycemia. Question 10. The nurse is caring for a client who received a medication overdose and is now experiencing a seizure. The client's family states that the client took an unknown number of pills, but they were for anxiety. The nurse should anticipate an order for which of the following? 1. Naloxone, 2. Flumazenil, 3. Protamine sulfate, 4. Atropine. Correct answer, 2. Flumazenil. Rationale. The client's history of taking pills for anxiety and now experiencing a seizure strongly suggests a benzodiazepine overdose. Flumazenil is the specific benzodiazepine receptor antagonist used to reverse the sedative and other effects of a benzodiazepine overdose. It will reverse the client's sedation and hopefully stop the seizure. Incorrect option 1. Naloxone is for opioid overdose. Incorrect option 3. Protamine sulfate is for a heparin overdose. Incorrect option 4. Atropine is an anticholinergic medication used to treat bradycardia or nerve agent exposure, not a benzodiazepine overdose. Clinique RN Test-Day tip. When a question involves an overdose, look for clues that point to a specific class of drugs. Anxiety pills and seizure are classic clues for a benzodiazepine overdose, which points directly to the correct antidote. Question 11. The nurse is caring for a client who is experiencing severe hypoglycemia. The client is unconscious and unable to take oral glucose. The nurse should anticipate an order for which medication? 1. Insulin glargine, 2. Glucagon, 3. Metformin, 4. Lidocaine. Correct answer, 2. Glucagon. Rationale. Glucagon is a hormone that stimulates the liver to release stored glucose, glycogenolysis, thereby rapidly increasing blood glucose levels. It is the drug of choice for a client with severe hypoglycemia who is unconscious and cannot safely take oral glucose. Incorrect option 1. Insulin glargine is a long-acting insulin used to lower blood glucose and would be fatal in this situation. Incorrect option 3. Metformin is an oral hypoglycemic medication used for long-term diabetes management and is not used to treat acute hypoglycemia. Incorrect option 4. Lidocaine is an antiarrhythmic medication and has no effect on blood glucose. Clinique RN Test-Day tip. For a severe hypoglycemic episode, the first rule is to get sugar into the client. The second rule is to do it safely. If the client is unconscious, you can't use oral glucose, so you must use a parenteral medication like glucagon. Question 12. A nurse is assisting in the rapid sequence intubation of a client. The nurse should be prepared to administer succinylcholine. What is the primary purpose of this medication? 1. To induce amnesia and sedation. 2. To paralyze skeletal muscles and prevent laryngospasm. 3. To cause immediate respiratory depression. 4. To lower intracranial pressure. Correct answer. 2. To paralyze skeletal muscles and prevent laryngospasm. Rationale. Succinylcholine is a powerful, short-acting neuromuscular blocking agent. It is a depolarizing paralytic used in rapid sequence intubation to cause complete paralysis of all skeletal muscles, including the diaphragm and laryngeal muscles. This allows for easy passage of the endotracheal tube and prevents the client from moving or having a laryngospasm during the procedure. Incorrect option 1. Succinylcholine is a paralytic. It does not have sedative or amnestic effects. Incorrect option 3. While it paralyzes the respiratory muscles, the primary purpose is to facilitate intubation, not to cause respiratory depression as a desired effect. Incorrect option 4. Succinylcholine can temporarily increase intracranial pressure. It does not lower it. Clinique RN Test-Day tip. A paralytic is not a sedative. Always remember that clients who are paralyzed with succinylcholine are fully conscious and can hear everything. Sedatives must be administered before or with a paralytic to prevent psychological trauma. Question 13. The nurse is administering Amiodarone to a client with a history of recurrent ventricular tachycardia. The nurse should monitor for which significant adverse effect during a long-term infusion? 1. Hypokalemia. 2. Liver dysfunction. 3. Gastrointestinal bleeding. 4. Peripheral edema. Correct answer. 2. Liver dysfunction. Rationale. Amiodarone is a potent antiarrhythmic. While it is effective in treating dysrhythmias, long-term use is associated with a number of serious side effects, including pulmonary fibrosis, thyroid dysfunction, and liver dysfunction. The nurse should monitor liver function tests, LFTs, regularly. Incorrect option 1. Amiodarone is not associated with hypokalemia. Incorrect option 3. Gastrointestinal bleeding is not a primary side effect of amiodarone. Incorrect option 4. Peripheral edema is not a direct side effect of amiodarone. Clinique RN Test-Day tip. Amiodarone is a powerful drug with a lot of side effects. For the NCLEX, remember the TLC of amiodarone: thyroid, liver, and corneal deposits. It is also associated with pulmonary fibrosis. Question 14. A client is admitted with suspected cyanide poisoning. The nurse should anticipate an order for which medication? 1. Protamine sulfate. 2. Hydroxycobalamin. 3. Flumazenol. 4. Activated charcoal. Correct answer. 2. Hydroxycobalamin. Rationale. Hydroxycobalamin is the antidote for cyanide poisoning. It works by binding with cyanide ions to form cyanocobalamin, which can then be safely excreted by the kidneys. It is a fast-acting and highly effective treatment. Incorrect option 1. Protamine sulfate is for a heparin overdose. Incorrect option 3. Flumazenol is for a benzodiazepine overdose. Incorrect option 4. Activated charcoal is used to absorb ingested poisons, but is ineffective in cases of cyanide poisoning. Clinique RN Test-Day tip. For uncommon poisonings or overdoses, then NCLEX will often give you a very specific antidote. Remember that activated charcoal is for ingested poisons, while hydroxycobalamin is an antidote for systemic poisoning. Question 15. A client with a history of a deep vein thrombosis, DVT, is receiving a continuous infusion of heparin. The nurse notes that the client's APTT is 100 seconds. Therapeutic range is 60 to 80 seconds. The nurse should prepare to administer which medication? 1. Vitamin K. 2. Protamine sulfate. 3. Warfarin. 4. Alteplase, TPA. Correct answer. 2. Protamine sulfate. Rationale. An APTT of 100 seconds is well above the therapeutic range, indicating an increased risk of bleeding due to a heparin overdose. Protamine sulfate is the antidote for heparin. It binds to heparin and deactivates it, rapidly reversing its anticoagulant effects. Incorrect option 1. Vitamin K is the antidote for a warfarin, Coumadin, overdose, not heparin. Incorrect option 3. Warfarin is another anticoagulant and would not be used in this situation. Incorrect option 4. Alteplase, TPA, is a fibrinolytic agent used to break down clots, which would be extremely dangerous and contraindicated in a client with a high bleeding risk. Clinique RN Test-Day tip. Remember the specific antidote for each anticoagulant. Protamine sulfate for heparin and vitamin K for warfarin. This is a classic NCLEX pairing. Question 16. A client with a history of supraventricular tachycardia, SVT, is receiving adenosine via a rapid forepush. The nurse should be prepared to observe which of the following effects immediately after administration. 1. Profound bradycardia and a short period of asystole. 2. Significant hypertension and tachycardia. 3. New onset ventricular fibrillation. 4. Increased urine output and hypotension. Correct answer. 1. Profound bradycardia and a short period of asystole. Rationale. Adenosine is an antiarrhythmic medication used to treat SVT. Its mechanism of action involves slowing conduction through the AV node, which can temporarily cause profound bradycardia or a brief period of asystole, a flatline on the ECG. This is an expected and desired effect as it allows the heart's normal electrical rhythm to reset. The nurse must warn the client about this and ensure they are on a cardiac monitor. Incorrect option 2. Adenosine causes vasodilation, which leads to a temporary drop in blood pressure, not hypertension. Tachycardia is the opposite of the intended effect. Incorrect option 3. Ventricular fibrillation is a life-threatening arrhythmia. While a brief period of asystole is expected, ventricular fibrillation is a critical, adverse reaction and not a desired outcome. Incorrect option 4. While adenosine can cause a temporary drop in blood pressure, it does not directly affect urine output in a way that would be a primary concern. The most immediate and critical effect is on the heart's rhythm. Clinique RN Test-Day tip. For adenosine, remember its half-life is incredibly short, less than 10 seconds. This is why it must be pushed fast, and you should always be prepared for a brief pause in the client's heart rhythm. Question 17. The nurse is administering Dantrolene to a client with malignant hyperthermia. The nurse understands that the primary purpose of this medication is to 1. Increase the client's core body temperature. 2. Cause immediate muscle paralysis. 3. Promote systemic vasodilation. 4. Relax skeletal muscle rigidity and reduce heat production. Correct answer. 4. Relax skeletal muscle rigidity and reduce heat production. Rationale. Dantrolene is a direct-acting skeletal muscle relaxant. Malignant hyperthermia is a life-threatening, inherited condition triggered by certain anesthetics. It causes severe muscle rigidity, a rapid increase in body temperature, and hypermetabolism. Dantrolene works by interfering with the release of calcium from the sarcoplasmic reticulum, directly relaxing the rigid muscles and stopping the hypermetabolic state that produces excess heat. Incorrect option 1. Dantrolene is given to lower the client's body temperature, not increase it. Hyperthermia is a key symptom of the condition. Incorrect option 2. While Dantrolene is a muscle relaxant, its primary purpose here is to reverse the rigidity of malignant hyperthermia, not to induce paralysis for a procedure. Incorrect option 3. Systemic vasodilation is a side effect of some medications, but is not the primary mechanism of action of Dantrolene for treating malignant hyperthermia. Clinique RN Test-Day tip. The classic signs of malignant hyperthermia are a sudden, unexplained rise in body temperature and severe muscle rigidity. The drug to reverse this is almost always a question on the NCLEX. Question 18. A client is receiving Mannitol for cerebral edema. Which of the following findings would be the highest priority for the nurse to report to the healthcare provider? 1. Urine output of 200 milliliters in 4 hours. 2. Crackles in the lungs on auscultation. 3. Serum sodium level of 140 milliequivalent/L. 4. Blood pressure of 130/80 mmHg. Correct answer. 2. Crackles in the lungs on auscultation. Rationale. Mannitol is an osmotic diuretic used to draw fluid from the brain and into the bloodstream to reduce cerebral edema. A serious side effect is fluid overload, which can lead to pulmonary edema. Crackles in the lungs are a classic sign of fluid accumulation in the lungs and indicate a life-threatening complication that requires immediate intervention. Incorrect option 1. A urine output of 200 milliliters in 4 hours, 50 milliliters per hour, is within the normal range and indicates that the medication is working. A urine output of less than 30 milliliters per hour would be a concern. Incorrect option 3. A serum sodium level of 140 milliequivalent/L is within the normal range, 135 to 145 milliequivalent/L. While mannitol can cause electrolyte imbalances, this value is stable. Incorrect option 4. A blood pressure of 130/80 mmHg is a reasonable finding and not a sign of a critical adverse reaction to mannitol. Clinique RN Test-Day tip. For diuretics, always remember the major side effect is a fluid or electrolyte imbalance. For mannitol, the risk is pulling too much fluid into the vasculature, causing pulmonary edema. Think fluid overload. Question 19. A nurse is teaching a client about self-administering Clopidogrel following a recent heart attack. Which statement by the client indicates a need for further teaching? 1. I should take this medication with food to prevent an upset stomach. 2. I will let my dentist know I am taking this medication before my procedure. 3. I will avoid taking ibuprofen or aspirin while on this medication. 4. I will stop taking this medication if I notice any bruising. Correct answer. 4. I will stop taking this medication if I notice any bruising. Rationale. Clopidogrel is an antiplatelet medication, often referred to as a blood thinner. It works by preventing platelets from clumping together, which increases the client's risk for bleeding and bruising. While bruising is a common and expected side effect, the client should not stop taking the medication without consulting their healthcare provider. Stopping the medication could increase their risk of a blood clot and another heart attack. Incorrect option 1. Taking the medication with food is a good strategy to prevent gastrointestinal upset. This is a correct statement. Incorrect option 2. Notifying the dentist is a crucial safety step. Since Clopidogrel increases bleeding risk, the dentist needs to know to take appropriate precautions before a procedure. This is a correct statement. Incorrect option 3. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and aspirin, also have antiplatelet effects and can significantly increase the risk of bleeding when taken with Clopidogrel. This is a correct statement. Clinique RN Test-Day tip. For any antiplatelet or anticoagulant, the biggest teaching point is to never stop the medication abruptly without a provider's guidance, even if you see signs of bleeding. Question 20. A client with a history of hypertension is prescribed hydralazine. The nurse should monitor the client for which of the following common side effects? 1. Persistent dry cough. 2. Bradycardia. 3. Headache and flushing. 4. Hypokalemia. Correct answer. 3. Headache and flushing. Rationale. Hydralazine is a direct-acting vasodilator. Its mechanism of action can cause a reflex increase in heart rate and is a common cause of headaches and flushing due to the dilation of blood vessels. These are the most common side effects. Incorrect option 1. A persistent dry cough is a classic side effect of ACE inhibitors, like lisinopril, not hydralazine. Incorrect option 2. Hydralazine can cause a reflex tachycardia as a result of the vasodilation, not bradycardia. Incorrect option 4. While some diuretics can cause hypoglycemia, hydralazine does not. It is important to know the specific side effects associated with each class of medication. Clinique RN Test-Day tip. When a question presents a medication, consider its class. Hydralazine is a vasodilator, so its side effects are directly related to vasodilation. Think about what happens when blood vessels expand. You get a headache, and your face might get red. Great job with those 20 uncommon NCLEX meds. Don't forget to like, subscribe, and hit the bell for more practice. And if you want to try out our Q Bank, just click the link below to enjoy a free test and see how exam ready you are.